Cryosurgery or cryotherapy is a minimally invasive procedure that we use in order to treat and destroy solid tumors in the human body. It is a procedure that we can perform under local anesthesia and sometimes under mild sedation. Our group is based in Malaga, and it is one of the most experienced groups in the world using this technique. And we are a group of doctors specialized in different fields cooperating together. We have urologists, interventional radiologists, thoracic surgeons, traumatologists, cryosurgeons, general anesthesiologists, and so on. In this case, we are treating a patient that is coming from Germany that presents an intrarenal cancer that is also affecting the calyx. This patient had already been treated for a prostate cancer 5 years before and for a bladder cancer 7 years before. Of course, the procedure of choice proposed to him was a radical nephrectomy, but the patient, being very much concerned about the possibility of having a new cancer in the residual kidney, decided to ask us a second opinion in order to see if the kidney itself could have been spared while the cancer destroyed. The case will be done in the radiological set under CT guidance, and we will use a real-time CT in order to see what we are doing. The first thing to do is to study the images and decide how to put the cryoprobe inside the tumor and how many of them will be put. And then, after having disinfected the skin, after having done a local anesthesia, the probes are inserted, and we be very careful not to damage the surrounding organs and tissue. After the probes has been inserted, the cryoprobes are activated through argon gas flowing inside them in a way that the temperature inside the probes is lowered to minus 185 degrees, and this will generate ice balls very cold from each cryoprobe, and each ice ball merging to the other will have the capability to cover the whole extension of the cancer. Afterwards, the cryoprobe will be removed and the patient discharged 24 hours later, and the patient could go home, take a plane, and he will come for a control at 3 months to see how the situation is going. Because this procedure can be repeated if necessary, but is rarely necessary to repeat it. But it can be also associated to the more traditional therapies like chemotherapy, radiotherapy, traditional surgery. This procedure is already performed in many cancer sites around the world, and the satisfaction of patients and of doctors grant to it a very interesting way to insert this technique inside the armamentarium of our self-doctors treating cancer.